say that in healthcare, every second counts.
The Urgent Care Center or UCC, in comparison to the ER, is a specialized fast-track stream. It is designed to see minor illnesses such as minor fractures, minor burns, or acute pain na hindi kailangan ng masyadong maraming tao o action tulad na sa emergency department.
Good day! Well, when medical concerns suddenly arise, many people are often unsure where to go for immediate treatment. Should it be the emergency room or is it urgent care, the more appropriate option? Understanding the difference between urgent care and emergency care is important in helping patients receive timely and proper medical attention. Before we get into today's conversation, grab your cup of coffee. And join us on Freshly Brewed, where compelling conversations brewed between fascinating guests and BusinessMirror's journalist hosts. In this episode, we discuss the role of urgent care in today's healthcare landscape and how Makati Medical Center is helping improve access to immediate medical services through its newly launched Urgent Care Center. Joining us today is Dr. Amado A. Flores III, Head of the Emergency Department and Urgent Care Center of Makati Medical Center, together with our very own Ruth Dela Cruz, BusinessMirror's Health and Fitness Editor.
Good day and welcome to Freshly Brewed, where we bring you conversations that inform, inspire, and empower. This is Ruth Dela Cruz, Health and Fitness Editor of BusinessMirror. And today we are talking about something that affects all of us, knowing where to go when medical concerns arise. But before that, don't forget to subscribe to our YouTube channel and like and follow our Facebook page. Many people often confuse urgent care with emergency care. Some rush to the emergency room for conditions that may be managed through urgent care, while others delay seeking emergency treatment because they underestimate their symptoms. So how do we know the difference? And why is understanding it so important? Joining us today is Dr. Amado A. Flores III, Head of the Emergency Department and Urgent Care Center of Makati Medical Center, to help us better understand the role of the hospital's newly launched Urgent Care Center and how it can help patients receive timely and appropriate medical attention. Good day, Doc Mads, and thank you for joining us.
Good day, Miss Anne. Good day to everyone. And thank you very much for inviting us to this program.
Thank you. So to begin, Doc, can you tell us about the newly launched Urgent Care Center of Makati Med?
Yeah, thank you very much. And I'm actually excited to tell you that we already have the Urgent Care Center. This is a new center wherein the patients can actually get medical attention that is not really life-threatening at all, but it still needs a timely and response for their medical needs. So it's a place where they can seek medical consults for anything that they need that doesn't need the emergency care that we usually do.
Okay. So what inspired Makati Med to establish a dedicated urgent care center?
Thank you very much. Basically, it's our patient, it's our patrons that inspired us to do this.
Okay.
The Makati Medical Center Emergency Department is a very crowded emergency department. We have a high volume of patients. And sometimes when our patient needs medical attention, they go to the emergency department for these needs. And sometimes they wait for a while because of an overcrowding. And this basically inspired us to give them a new place wherein they can still seek consult when they need to, but they are not in the emergency room.
Okay, so how many clients or patients do you deal with in the emergency department on a daily basis?
So in the daily basis in Makati Medical Center, in our peak is about 200 to 250 patients in a 24-hour. So we are really a high volume emergency department.
Yes, and these cases range from what, trauma? Heart attack or
it's anything under the sun. So we see everything from simple cough, colds to our complex cases such as our critical traumas, complex medical cases. So when we say emergency, we see anyone and whatever condition they have.
Okay, so for viewers who are hearing about this for the first time, what exactly is urgent care? And what is the difference between urgent care and emergency care?
Okay, the main difference of an emergency and urgency is basically on the symptomatology. It's
Okay.
the acuity, or we say that's the severity of the illness.
Okay.
So when we say in an emergency department, the main ER, it is designed to see life-threatening conditions.
Okay.
When we say life-threatening conditions, these are the major trauma, the complex medical emergencies, wherein every minute matters. It's very critical that we give them timely treatment because it is life-threatening.
Okay.
If we miss by simple seconds, it is a line between death and life.
Okay. Okay.
Now, when we say an urgent care clinic, these are cases that still needs to be seen immediately,
Okay.
but it's not that life-threatening. It's
Okay.
a lower acuity of cases, okay, but still needs immediate attention. So these are like minor traumas, stable patients with fever, stable cases
Okay.
that can be seen, and that doesn't need the requirement, the usual requirement or the loaded requirement that we see in the typical emergency room.
Okay, so let's for example, I go to the hospital, right? Let's say I twisted my ankle.
Yes.
What would be my patient journey? I
Okay.
would go to the emergency, for example. So what will happen to me?
Yeah. Before we don't have the urgent care center,
Yeah.
you go to the emergency department when you have any simple case of any trauma like that,
Okay.
an ankle sprain, for example, when you twist your foot and you don't know if it's a fracture or ankle
Yes.
sprain, you go to the emergency department. Now, with the urgent care center and your ambulatory, you can still walk.
Yep.
You can go to the urgent care center and we can triage you there. We can
Okay.
see if your case can be seen at the urgent care center or you need to be seen at the main emergency department because you need more tests or you
Okay.
need more attention to that.
Okay, so how can patients determine whether they should go to urgent care center or directly to the emergency room?
Okay. So to answer that question, basically, let's go to what is life-threatening condition. So when we say life-threatening condition, let's go with our ABCs.
Okay.
We like that. If there's something wrong with the airway,
Airway,
or when you
okay.
entering the airway, there's an obstruction. When there is a problem with the breathing, you're
Okay.
breathing too fast, your oxygen saturation is too low, and then your circulation basically is your heart rate is too fast,
Okay.
and your blood pressure is too low, you feel clammy, and you're unstable. And then if your fever is too high, around 40, and then you're very weak, you have some changes in behavior, those are emergencies. Anything that is life-threatening, that is vital, that is threatening your vital signs, that's an emergency.
Okay, okay.
So when you have those symptoms, you have to go immediately to the emergency department. So if you're having chest pain, severe chest pains, and you're having difficulty of breathing, and then you are clammy, you're perspiring a lot, go immediately to the emergency department.
And so can you share some conditions that may be treated at the urgent care naman?
No. Now, for the urgent care center, since these are not life-threatening
Yes.
situation, but still needs timely management, these are minor traumas. For example, if you have an animal bite,
Okay.
and then because of an animal bite, you have to have tetanus prophylaxis and of course rabies prophylaxis. So we have to assess if you need those vaccine,
Okay.
because those vaccine needs to be given in a timely manner. If you have minor traumas such as cuts, wounds, and minor burns, and if you have some infection like cough, colds, fever, but you're stable enough, you can still talk, you can still walk around, and it's not too high of a grade of fever. And then if you have some acute pains, pains that we can give you oral medications and not IV medications, and it's not too painful enough, then we can go to the urgent care center.
Okay. Is the urgent care center operational 24/7?
Currently, it's operational 12 hours.
Okay.
It's for Makati Medical Center. It's 10 a.m. to
Okay.
10 p.m.
Okay.
We actually made it to in a way that we are catering to the highest number of patients when we have a surge of patients in the emergency department. So we are in a business district, so most of our
Yes.
patients are in that situation wherein when they after office hours they want to go seek consultation and the clinics are already closed,
Okay.
then they go to the emergency department. So we
Okay.
designed our office hours to cater to those time frame.
So, after this discussion we have, why is it important for the public to better understand this distinction between urgent care and emergency care?
That's a very good question. You know what? When for us Filipinos, time is very important. We
Yes.
respect our time, and then when a patient goes to the emergency department, they think that their case is an emergency,
Yes.
and they want immediate attention. What they don't know is that every patient in the emergency department is different. So we see them differently based on their acuity, and once their condition is not too serious, sometimes they have to wait
Yes.
because we are attending to critical patients. And when these patients are actually overcrowding the emergency department, they are utilizing the resources of the hospital. And when you are, the most important resources will be the doctors, the nurses. And when we are doing our job to save a life, then we really cannot immediately go attend to them. So when you are overutilizing the resources,
Yes.
and then you are wasting not just the time of the hospital, but also money, patient safety.
Yes, yes,
So it's
patient
important
safety.
that we separate these two patients, those who are in life-threatening condition and those on non-life-threatening condition. But still, we give them the proper treatment, the proper timely treatment that they need. But into a system that they are not worried, they are not anxious because they are in the same area wherein we are seeing critical patients, blood, for example, or those patients with having difficulty of breathing, and they see, and of course those patients in needing resuscitation. You don't want to be in that area.
Yep, yep. And there's also this fear of getting infections.
Yes,
Doc?
it's part of that.
Okay. So in your experience, Doc, what are some of the most common misconceptions people have about emergency rooms?
Okay, I hope they will not be angry with me. Most of the common misconception is number one would be there is a priority for elderly. We have for senior. Of course, we understand that elderly patients are frail and they have a lot of medical condition, but sometimes their concern is not really emergency enough. Okay, so we don't have the first come first serve basis type of system. So we see patients based on the acuity of their illness, based on the triaging. We use a triage system wherein we separate and then we separate them in terms of the acuity or the severity of their illness.
Okay. So how does an urgent care center help patients receive timely medical attention?
Okay. Because of the urgent care, we see lower acuity patients. These patients doesn't need too much resources. The turnaround time there is much faster compared to the emergency department. Number two, we have dedicated doctors there that are that can see them faster compared to the emergency room. Number two, it's a more quieter place, more efficient and streamlined service compared to the emergency department where they have to wait. And this because we designed it to be a fast track stream, so they are seen in a timely manner, but the same level of expertise.
Okay. What's the turnaround time in an urgent care center?
The
ideal turnaround time.
Thank you very much for that question and asking it the ideal.
Yes, the
The
ideal.
ideal turnaround time should be less than 60 minutes.
Oh, that's
60 minutes.
that's fast, huh?
Yeah, but
compared to a emergency room, which is around 4 to 6 hours.
Yes.
if I'm
For
not
the
mistaken.
emergency room, it depends on your condition.
Yeah, the condition.
You can stay it can be as fast as 1 hour to 2 hours to as long as 4 or 5 hours. But we target a 3-hour disposition time wherein we have seen you and we have a disposition. It's either we discharge you or admit you or any other disposition. So in the urgent care center, it should be a faster.
Turnaround time. Okay, so what services and facilities are available at the Makati Medical Center Urgent Care Center?
Okay, so since it will cater to non-life-threatening condition, it's basically basic facility. We have a treatment room, 2 consultation rooms, and then we have the medication area. So they can have their minor blood tests there, urinalysis, blood tests, even ECG and chest X-rays can be done there.
Okay. Is urgent care ideal for patients who need immediate attention but may not necessarily require
Yes,
confinement?
definitely. That is the major point of the urgent care. These are patients who needs immediate attention, but not really that life-threatening. But they really need to be seen immediately, as compared to waiting for a clinic, because sometimes your condition can be seen at the clinic. You don't
Yeah,
you
that's
can
true.
wait. So these are cases that patients feel that they can't wait. I need to be seen by a doctor right now. I am not comfortable waiting
Yes,
for my
yes.
doctor for tomorrow's clinic or later. I want to be seen now.
Okay.
Because for us, when you feel that your case is an emergency, that is an emergency.
Okay.
But when our nurses would assess that your case is not really an emergency, this is a lesser acuity, then it's an urgent care.
Okay, so just to reiterate what we discussed earlier, what can patients expect in terms of convenience, waiting time, and overall patient experience?
Okay, thank you very much for that one. For our urgent care, they can expect faster turnaround time, a quieter space wherein they would wait for their disposition faster, more efficient and streamlined service, as I've mentioned.
Okay.
And then, of course, still the same expertise, because our our urgent care is still manned by emergency medicine specialists. So
Okay.
these doctors know when an urgent condition can be emergent. So there is a faster or a better way of transitioning from urgent care to emergency.
Okay. So sometimes people delay seeking medical attention because they are unsure if their condition is serious enough.
Yes.
So what advice can you give to the public?
Okay. When you feel that your condition is not serious enough, but still you are worrying about it, it's still important that you seek medical attention.
Okay.
Because the expert is the one who can tell you that you need immediate attention.
Okay.
If you go to the emergency room or the urgent care center, we have the specialists there, the triage nurses, that can tell you that your case is emergency now, you have to be seen, or it's an urgent care case, we can see you not in a full emergency, but in a faster way.
Okay.
So, but please do not delay any form of condition that you feel, because it's very difficult if we see you late. Okay?
Yeah, that's true.
So any form of, if just for example, you're just feeling a little bit dizzy, a little bit discomfort, unusual to what you're really feeling, you feel that you have neck
Excuse
pain
me.
or headache, seek medical attention immediately.
So how can proper healthcare navigation improve outcomes for patients while also helping hospitals deliver better care?
Okay, thank you very much. That's a very good question. So when we say patient navigation, it's really separating the two streams of the patient. As
Yeah,
I mentioned a
okay.
while ago, the
Yes, yes.
two streams would be the emergency cases and this the other case is the urgent care, wherein this stream of patients do not need that much emergency care.
Yes.
So when we have two separate streams of patients, we don't go in that gridlock.
Okay,
Wherein
okay.
that's the usual problem of emergency departments right now.
that's true.
They are in the gridlock wherein these patients, those lower acuity cases, are waiting in the emergency department, anxious.
Yes,
They don't know
yes.
what's happening,
Yep.
and then their time is wasted because of waiting. Now, when you have two systems, a streamline of patients, then it's a more faster and efficient way of delivering care to our patient. This is a more safe way of patient care.
Okay. So before we end, Doc Mads, what message would you like to share with viewers about knowing when and where to seek medical care?
Thank you very much. I would like to answer that question by saying that the current definition of emergency right now. The current definition of emergency right now is contextual. It means that it depends on the context or the perception of the person.
Okay.
If you feel that you are in a situation wherein your symptoms, what you're feeling, needs immediate attention or you need immediate medical attention, it can be considered as an emergency.
Okay.
But not all emergencies are true emergencies.
Yes.
We have true emergencies, the life-threatening conditions that we have to cater first and see first. And we have this set of patient that really not on a life-threatening condition, but it still needs to be seen in a responsive manner. And if they would overcrowd the emergency department, then definitely this will have poor outcome for our patients, and then sometimes they have lesser patient satisfaction because
Okay.
of the waiting time. So for us, it's learning and knowing where to go now.
Okay.
If your condition you think it's not that too serious, you're stable enough, then try the urgent care center first, and then we'll tell you if you can be seen there or you have to be seen at the emergency department.
Okay. And where can viewers learn more about the Makati Medical Center Urgent Care Center?
Of course, you can check us in our Facebook page, Makati Med, and then our website, makatimed.net.ph, so you can see our services there. We also have our own emergency department Facebook page.
Okay. Oh, wow. Okay. So thank you very much, Dr. Mads, for joining us today and for helping us better understand the importance of knowing the difference between urgent care and emergency care.
Thank you very much, Miss Anne, and thank you very much for all the listeners and viewers of this program.
Thank you. So to our viewers, we hope today's discussion reminded you that seeking the right care at the right time can make a big difference in protecting your health and well-being. Thank you for joining us here on Freshly Brewed. Stay informed, stay healthy, and we'll see you again next time.
And that wraps up today's episode of Freshly Brewed. Thank you for joining us as we discuss, give me a minute, the importance of understanding the difference between urgent care and emergency care, and why knowing where to seek treatment matters. Because when it comes to health, timely and appropriate care can make all the difference. For more stories and insights, visit BusinessMirror and follow us on our social media channels. Stay ahead, know more, take care, and I'll see you next time.